Today we're joined this afternoon with Maui Health CEO Mike Rembis. Of course, we reported yesterday about the cluster of 15 Maui healthcare workers at the hospital who tested positive for COVID-19. In light of that recent report, can you tell us where we stand at right now, what's being done immediately to ensure the safety of the workers, patients, and the community at large?
Be happy to. First of all, those 15 employees were not identified yesterday. That's over the course of over a month. We've had 15 employees. Only a small number, I believe it was 5, were identified the other day. But we still have 15 employees that tested positive. We've ensured that we're doing everything to protect the safety of our employees. That's the most important thing. Protecting our employees is paramount, so we can then protect the community and care for the community. To make sure we're doing everything right, I reached out to Bruce Anderson and the Department of Health, and we've implemented every single recommendation that they've suggested. In addition to that, we instituted screening for anyone walking in the hospital. Whether you're a visitor, a physician, an employee, you're going to be screened with temperatures and questions about your health condition before you can enter the hospital, and given a mask. That's not the only mask employees will have, but everybody walking in will have a mask. You must wear a mask the entire time you're in the hospital. And if employees need to change their mask, there's more masks for them available. But everyone walking in will get a mask, and they will be tested so we can screen them to the best of our ability. One of the most difficult things with this virus is so many people that are positive have no symptoms. And that is probably what the biggest challenge for us throughout the country is how you deal with patients that have no symptoms yet potentially could be positive. But we're doing everything that the Department of Health recommends. We have always followed the CDC guidelines, and now we're also doing screening for anyone who walks into the hospital.
You know, hindsight is always 20/20. Is there anything you wish you could have happened in the last, say, month to prevent that current cluster from occurring?
Well, I wish I knew who had the coronavirus and was positive without symptoms. We just don't have enough testing to test everybody. In a perfect world, we should be doing a lot more testing. We don't have that testing. I wish more people would let us know when they're not feeling well. You might not have a lot of the symptoms, but if you're not feeling well, you can at least do some more screening and make sure that you're not likely to have coronavirus. But we've been always following CDC guidelines, doing everything appropriate. This is a very difficult virus, and it outrages me that we even have any of our caregivers that are positive. But it's inevitable looking at what's happening throughout the country. What we need to do now is control it, mitigate it, and make sure we're ahead of the curve. The first thing we're doing right now, and this is important to understand, when you have someone that's positive, we immediately reached out to the Department of Health, and we traced back any employees that these employees may have contact with, any patients they may have had contact with, and we're testing them all. I can safely say we're going to be testing probably over 70 people yesterday, today, to make sure that if any of them are positive, we want to know. We will immediately put employees on furlough, get them out of the hospital, immediately place any patients that are positive in isolation so we can appropriately continue their care. Finding out if we have more positives is important so we can mitigate this, deal with it, so it doesn't spread. So we've worked with the Department of Health, and we're being very aggressive. Let's identify if we have any other ones, and if we do, let's take care of it immediately this week.
Okay, and this question comes from the community. We've been getting a lot of inquiries about hospital workers being told to remove their medical grade N95 mask and use an inferior surgical mask before entering the hospital or face suspension and potentially be fined. Is this true? And if so, what is the reasoning?
It's not true.
Okay.
We did have a couple employees that came in with their own N95s, and they wanted to wear them all day. Our only concern is that we need to figure out how we allow them to do it, and they are allowed to do it. But we don't want them walking around and letting the other employees think that they all should have N95s. And we don't know if the N95 they have has been soiled or if the N95 is a legitimate N95. So what we've asked them to do is they can wear it. We'll put one of the hospital surgical masks over it so that everyone sees it's their own personal mask, and we haven't issued N95s to select people who don't need them. If someone wants to wear their own, even though it's not needed in the workplace they're in, that's okay. But we need to find some way for their other care workers to know this is their own mask. And if they do bring in their own mask, we ask they take it off and put our N95 on when they're treating a patient. So we know they have proper equipment and it can be tossed out afterwards if appropriate. So we dealt with that for the first time today, and we're going to find a way to make it work for the employees.
That being said, can you provide a status update on the supplies, equipment, as well as any updates regarding the Army Corps of Engineers and their efforts to establish an alternate care facility on the island?
Sure. We have been ordering PPE, protective equipment, for all of our employees for literally months, never getting everything we want, but we believe we have adequate PPE supplies to deal with anything that's foreseen in the next few weeks. So we have no prohibition of any employee can have whatever PPE is required to do their job. We have adequate supplies, and we're trying to get even more in case there's a surge. But for right now, we have adequate PPE. We've ordered more equipment throughout the hospital. This is one of those cases, money's not an object. We want to get whatever this community needs. I've ordered more patient beds. I've ordered more filters. I've ordered ventilators. We have a number of orders of ventilators from the mainland that are on their way, all with different timetables. We are going to order and get whatever this community needs, and it's coming as fast as we can literally procure it. And the state's helping us, the hospital association's helping us, Kaiser Permanente is helping us. And we know that the Army Corps of Engineers has a plan, working with the state and with the county, to put up a hospital somewhere near the airport. We are not involved in that at all. We're kept informed about it. We know that the facility is somewhere on the island, and I believe there's some National Guard ready to help, but I have not been informed on where they are in those plans.
Okay, great. Anything else that you'd like to share that you think is important to pass on to the community?
Only two things. We've always followed the CDC guidelines, and they have changed. At one time, not everybody was recommended to wear a mask. We've changed as soon as they've changed, and we will do whatever it's necessary to protect our healthcare workers. Always. And that is the most important thing, because we want to protect the community. And without our healthcare workers, we can't do that. So we are disappointed some tested positive. We will do whatever we can to mitigate it, control it. If anybody else tests positive, get them out of the hospital. Let's get them healthy again and take care of our community. That's my concern. And our physicians stand by my side. They are also wanting to make sure we have the best for our community. And we're doing everything the medical professionals have recommended.
Okay, great. Thank you so much, Mike Rembis, again, CEO for Maui Health Systems. Also, special thank you to Mahie Wong and Erica with Maui Health and Sherry Grimes with our own Pacific Media Group. Thank you very much, and be sure to update with us with any further information that you get.
Be safe. We're all in this together. Thank you.
Thank you.